Somewhere in your neck, right now, a gland smaller than a golf ball is quietly deciding how tired you feel, how warm you are, and how fast your heart beats. Most people never think about it until it stops working properly. That gland is the thyroid, a butterfly-shaped organ wrapped around your windpipe, just below your Adam's apple. Two wing-shaped lobes, connected by a thin bridge of tissue, quietly running one of the body's most important control systems. Here's exactly where it sits and what it looks like. Nestled in the front of your neck, wrapping gently around the windpipe, made of thousands of microscopic follicles that manufacture hormone around the clock. In India specifically, thyroid disorders affect roughly 11% of the population, noticeably higher than the US at around 4.6% or the UK at around 2%, largely a legacy of historical iodine deficiency across parts of the country. Globally, the most common underlying cause, Hashimoto's autoimmune thyroiditis, affects around 7.5% of adults, and women are affected roughly 4 times as often as men. This is genuinely common, not a rare diagnosis. So what does this small gland actually run? An enormous amount. How fast you burn energy, how warm your body stays, how fast your heart beats, and even how your brain and mood function day to day. Before we go any further, an important disclaimer. This video is for general education only. It is not medical advice, and it cannot diagnose you. Thyroid disease is confirmed with a real blood test ordered by a real doctor. Please don't self-diagnose or self-medicate based on anything here. With that clearly said, let's actually understand how this gland works, starting with the surprisingly elegant chain of command that controls it. Your thyroid mainly produces 2 hormones. Thyroxine, called T4, is the storage form, made in huge quantities but relatively inactive. Triiodothyronine, called T3, is the active form, far more potent, but made in tiny amounts. But the thyroid doesn't act alone, it takes orders from above. The hypothalamus releases TRH, which tells the pituitary gland to release TSH, which in turn tells the thyroid exactly how much T4 and T3 to produce. This system runs on a feedback loop exactly like a thermostat. When thyroid hormone levels drop, the pituitary senses it and releases more TSH to push production up. When levels are high enough, TSH drops back down. That's why a TSH test is so revealing. It's the system's own built-in gauge. Keep these 4 names straight because your doctor will use all of them. TRH starts the chain, TSH carries the order, T4 is the hormone made in bulk, and T3 is the active hormone your cells actually respond to. By volume, your thyroid produces roughly 99.9% T4 and only about 0.1% T3. But don't let that tiny percentage fool you. Nearly all of that T3 comes from T4 being converted inside your tissues, right where it's needed. One more hormone worth knowing, since you asked about all thyroid-related hormones. Calcitonin. It's made by different cells within the same gland and has a completely separate job, helping regulate calcium levels in your blood and bones. So think of it this way. T4 is the warehouse stock, T3 is the product actually being used on the shop floor. Your body keeps a large reserve of T4 specifically so it always has raw material to convert into active T3 exactly when and where it's needed. So that's the full chain. Brain signals, pituitary relays, thyroid produces, tissues convert and use. Hypothyroidism means this chain breaks down somewhere, and next we'll look at exactly what that breakdown actually does. With that chain in mind, hypothyroidism has a precise definition, not just feeling tired, but a specific hormonal pattern your doctor can actually measure. Think of your thyroid as your body's thermostat and throttle combined. It doesn't just regulate temperature, it sets the pace for nearly every metabolic process you have. Turn that throttle down and everything downstream slows with it. The actual definition, hypothyroidism, means too little T4 and T3 in your blood, and, because of that feedback loop we just covered, a compensating rise in TSH as your pituitary tries desperately to push the thyroid into working harder. That's exactly why hypothyroidism causes such a strange, sprawling list of symptoms rather than one specific complaint. Because literally every cell in your body has receptors for thyroid hormone, and every one of them slows down together. Picture the practical difference this makes day to day. A normally functioning thyroid means steady energy, normal body temperature, and a comfortably paced heart rate. A slowed thyroid means persistent fatigue, feeling cold when others don't, and a measurably slower heart rate. There's also an important distinction doctors make: overt hypothyroidism, where both TSH is high and T4 is clearly low, versus subclinical hypothyroidism, where TSH is mildly elevated but T4 is still technically within normal range, an earlier, milder stage. So hypothyroidism isn't vague at all. It's a specific, measurable hormonal pattern with a specific whole-body reason for causing the symptoms it does. So what actually breaks this system in the first place? The honest answer is several genuinely different things, and figuring out which one applies to you changes the entire treatment conversation. In countries with adequate dietary iodine, the leading cause by far is Hashimoto's thyroiditis, an autoimmune condition where your own immune system mistakenly produces antibodies that attack and gradually damage thyroid tissue. Globally, Hashimoto's affects about 7.5% of adults on average, though that number swings meaningfully by region, running higher in lower-income regions where diagnosis and iodine access both vary widely. Beyond autoimmunity, several other genuinely distinct causes exist. Iodine deficiency, still the single leading cause worldwide when you count every country. Certain medications like lithium and amiodarone, prior thyroid surgery or radioactive iodine treatment, and postpartum thyroiditis after childbirth. Doctors also sort causes into two broad categories: primary hypothyroidism, where the problem sits in the thyroid gland itself, and secondary hypothyroidism, the rarer situation where the thyroid is fine but the pituitary isn't sending it proper instructions. This is exactly why India's numbers look different from the US and UK. A legacy of regional iodine deficiency layered on top of the same autoimmune risk every population shares. One myth worth retiring: eating soy or cruciferous vegetables like broccoli causes hypothyroidism. It doesn't. In typical dietary amounts, these foods have no meaningful effect on thyroid function in people with adequate iodine intake. One pattern worth knowing if you already have Hashimoto's: autoimmune conditions genuinely tend to cluster. Having one, type 1 diabetes, celiac disease, vitiligo, modestly raises the odds of having another, which is why doctors often screen more broadly. So the honest picture is multiple real causes, autoimmunity leading in iodine-sufficient regions, iodine deficiency still leading worldwide, and getting the actual cause right matters for how it's managed. Because thyroid hormone touches nearly every cell, its symptom list is famously long, famously vague, and famously easy to blame on something else entirely: stress, aging, or just being busy.
Quick pause. If this breakdown is helping you, take a second to hit like and subscribe. It genuinely takes a lot of effort to make videos like this, and your support keeps them coming.
The core cluster looks like this: persistent fatigue that doesn't improve with rest, unexplained weight gain, feeling cold when others are comfortable, thinning hair, constipation, dry skin, muscle aches, and a foggy, sluggish feeling in your thinking. In more advanced or long-standing cases, the thyroid gland itself can visibly enlarge, a swelling in the neck called a goiter shown here. It's the body's attempt to compensate by growing more tissue to try to make up for reduced hormone output. One myth worth correcting immediately: if I don't have a visible neck swelling, I don't have a thyroid problem. Most people with hypothyroidism, especially early on, have a completely normal-looking neck. A goiter is a possible sign, never a required one. That vagueness has a real cost. Research consistently shows hypothyroidism is widely under-recognized, with many people living with unexplained symptoms for years before a simple blood test finally identifies the actual cause. A few symptoms deserve urgent attention rather than a routine appointment: severe confusion, extreme sensitivity to cold, significant swelling, or slowed breathing can signal a rare but serious complication called myxedema. This needs emergency care, not a wait-and-see approach. So take the vague, sprawling symptom list seriously rather than explaining it away. The only way to actually tell fatigue from life apart from fatigue from thyroid is a simple blood test, which is exactly what's next. Good news on the diagnosis front: it's simpler, cheaper, and less invasive than most people expect. Often a single blood draw is enough to get a clear answer. A real visit typically starts with history, taking about symptoms and family history. A physical exam checking your pulse, reflexes, and gently feeling your neck for any enlargement, followed by a simple blood draw. The single most important test is TSH, thyroid-stimulating hormone. Because of that feedback loop we covered earlier, TSH is more sensitive than T4 itself at catching even subtle thyroid problems, which is why it's always the first test ordered. The full workup usually follows a logical order: TSH first as the screening test, free T4 next if TSH comes back abnormal, and thyroid antibody testing, usually anti-TPO, if an autoimmune cause like Hashimoto's is suspected. A commonly used normal TSH range runs roughly from 0.4 to 4.0 ml per liter, though exact reference ranges vary slightly by laboratory and by individual factors like age and pregnancy. Your own doctor's interpretation always matters more than any single generic number. Here's what an elevated TSH actually looks like plotted on that reference range, clearly outside the normal window, which is exactly the kind of result that prompts a doctor to check free T4 next and build the complete picture. Put the two patterns side by side one more time. Subclinical hypothyroidism shows mildly elevated TSH with a still normal free T4, while overt hypothyroidism shows a clearly elevated TSH paired with a free T4 that's actually dropped below normal. So the practical decision path is short. Symptoms prompt a TSH test, an abnormal TSH prompts a free T4 test, and that combination, plus your doctor's clinical judgment, determines whether treatment starts. So diagnosis really is this straightforward. One blood test as a starting point, a couple of follow-up tests if needed, and a clear, confirmed answer, no guesswork required. The good news: hypothyroidism is one of the most reliably treatable conditions in all of medicine. The standard treatment has decades of evidence behind it, and for most people it works remarkably well. The standard first-line treatment is levothyroxine, a synthetic, lab-made version of T4, chemically identical to the hormone your thyroid would normally produce itself. Once swallowed, it enters your bloodstream exactly like natural T4, gets converted into active T3 by your tissues on the same as needed basis, and simply replaces what your thyroid isn't making enough of anymore. How you take it genuinely matters for how well it's absorbed. On an empty stomach, first thing in the morning, then waiting at least 30 to 60 minutes before eating, drinking coffee, or taking calcium or iron supplements, which can all interfere with absorption. Critical safety point, tied directly to our earlier disclaimer. Never adjust your own dose, stop suddenly, or switch brands without your doctor's involvement. Dosing is individualized, and even small, unsupervised changes can meaningfully affect how you feel. The monitoring timeline is predictable. A follow-up TSH check around 6 to 8 weeks after starting or changing a dose, since it takes that long for levels to fully stabilize, then periodic rechecks, often annually, once your dose is confirmed correct. One more myth worth balancing honestly: natural desiccated thyroid extract isn't automatically superior to synthetic levothyroxine. Major medical guidelines still recommend levothyroxine as first line, though a small number of patients and doctors do find alternatives helpful in specific situations. Grading the overall evidence honestly: levothyroxine has decades of consistent clinical trial and real-world data behind it, and major endocrine societies worldwide continue to recommend it as the evidence-backed standard of care. So the treatment story is genuinely reassuring. One daily tablet, taken correctly, monitored properly, restores nearly everyone to feeling normal again. Let's ground this in a real kind of story. Fatima, 29, spent nearly 2 years attributing her exhaustion, weight gain, and hair thinning to work stress before a routine blood test, ordered for an unrelated reason, revealed a TSH of 9.4. A few situations need extra care and closer monitoring. Pregnancy, where thyroid hormone needs rise and untreated hypothyroidism can affect the baby's development, and older adults, where dosing is typically started lower and adjusted more gradually. Living well with hypothyroidism really comes down to a short list of habits. Take your medication consistently at the same time each day. Don't skip follow-up blood tests. Tell every new doctor about your diagnosis, and never stop treatment without medical guidance. Here's the genuinely reassuring bottom line. With correct, consistent treatment, the overwhelming majority of people with hypothyroidism live completely normal lives, full energy, normal weight regulation, and no meaningful limitation at all. One final, important reminder: everything in this video is general education, not a diagnosis and not a treatment plan. Thyroid disease is confirmed with real blood tests interpreted by a real doctor who knows your full medical history. Please see one for any of the symptoms or questions we've covered. So if anything in this video sounded familiar, here's a simple next step. Write down your symptoms, book an appointment, and specifically ask for a TSH test. A simple, inexpensive, and genuinely revealing first step. A small gland, a simple blood test, and a single daily tablet. That's the entire story of one of the most common, most treatable hormone conditions in medicine.
Here are the key references and sources for this video. Thanks so much for watching. If this helped, like the video and subscribe for more clear, simple explainers, and I'll see you in the next one.